Mark. I'm a respiratory therapy student and I'd like to discuss with you the two things to consider before putting the patient on mechanical ventilation. The first thing that you should consider before putting the patient on mechanical ventilation are the proper parameters. The first parameter would be the patient's ideal body weight in kilos. The second parameter would be the patient's tidal volume range. Usually between 6 milliliters per kilo would be the lower end and 8 milliliters per kilo would be the upper end. And the third parameter would be the liter flow. So the liter flow is basically the speed in which the tidal volume or gas is being delivered from the ventilator to the patient. The fourth and final parameter to consider would actually be the minimal frequency. So you want to set the minimal respiratory rate for the patient. So respiratory rate on the ventilator would be known as the frequency. So basically you want to make sure that you set the proper frequency between 14 to 16. You don't want to set it too low because you may cause the patient to be hypercapnic, but you don't want to set it too high because you may encourage the patient to actually hyperventilate on the ventilator. And the second and final thing to consider would be the patient's comfort or synchronization on the ventilator. So you want to make sure the patient is properly synchronized with the ventilator and is not fighting the ventilator. So the things you want to look at is the PIP, peak inspiratory pressure, the patient's exhale tidal volume, and also the patient's frequency. You want to make sure that the PIP doesn't goes above like in the 50s or 60s, and because it may result in the patient biting the ET tube. But also you want to make sure that the patient's exhale tidal volume is not too high or too low. Make sure that it's like 50 above and 50 below the preset tidal volume. And also you want to make sure that the patient's respiratory rate doesn't jump above 20, because that means the patient is possibly hyperventilating on the ventilator. And if any of these may be the case, you may want to recommend to the doctor to actually further sedate the patient. I hope this was helpful. Thank you for watching.